Hello, I am Abby Webb, and I am doing my presentation on pelvic floor physical therapy with the focus on endometriosis. This is for the course for PTA seminar. As an introduction, pelvic floor physical therapy was not really on my radar at all. It wasn't something I necessarily knew much about or had a whole lot of interest in until I was placed at my last clinical rotation and was able to work with a physical therapist who also specialized in pelvic floor physical therapy and got to experience a lot of pelvic floor patients. My interest in this also had a little bit to do with a friend of mine, so the two things kind of came together, which helped me choose this topic today. And I'll go more in depth into that throughout the presentation. So introduction, pelvic floor physical therapy is a specialty that does not get the attention it deserves. It's often really not well known. It is a skilled therapy that could benefit a good portion of the population. There is common misconception that pelvic floor physical therapy is only for females, but males can also benefit. I will discuss some of those benefits and reasons to consider pelvic physical therapy. Some of the objectives that I'm going to cover are including just a general overview of pelvic floor physical therapy, since it's not something we really got very in depth on. I'm going to review the muscles of the pelvic floor and perineum and give an overview of endometriosis, and then also discuss how those who've been diagnosed with endometriosis can benefit from pelvic floor physical therapy. For starters, what is pelvic floor physical therapy? On a very surface level answer, it is a therapy that focuses on the pelvic floor and perineum muscles, which play a significant role in a lot of major functions. Some are listed here. Definitely there are more, so I would say includes these but is not limited to these. But bowel and bladder function, support of the pelvic organs, and sexual function, arousal, and orgasm. The muscles of the pelvic floor. That is something that we did not really go into at all during school, so this was all very interesting to me. So the pelvic floor is also referred to as the pelvic diaphragm, and it is a muscular sheet that defines the inferior portion of the pelvic cavity. The pelvic floor extends anteriorly to posteriorly from the pubis back to the coccyx, and it is comprised of the levator ani and the ischio-coccygeus. Its openings include the anal canal and urethra, and in the case of women, the vagina. The large levator ani consists of two skeletal muscles, the pubococcygeus and the iliococcygeus. The levator ani is considered the most important muscle of the pelvic floor, which could be debated. That's what this source says, but I have definitely heard a lot about the obturator internus being the most important muscle, but we'll let other people decide on that. But it helps to support the pelvic viscera, pretty important, and it also resists the pressure produced by contraction of the abdominal muscles, so that the pressure is applied to the colon to aid in defecation and to the uterus to aid in childbirth, also very important. And it can also be assisted by the ischio-coccygeus, which pulls the coccyx anteriorly. This muscle also creates skeletal muscle sphincters in the urethra and anus. And muscles of the perineum. The perineum is a diamond-shaped space between the pubic symphysis, which is the anterior, and then the coccyx, which is posterior. The ischial tuberosities, which are on the lateral sides, and lies inferior to the pelvic diaphragm. It's divided transversely into triangles. The anterior is the urogenital triangle, which includes the external genitals, and the posterior includes the anal triangle, which consists of the anus. The perineum is also divided into superficial and deep layers, which some of the muscles common to men and women. Women also have the compressor urethrae and the sphincter urethrovaginalis, which functions to close the vagina. And in men, the deep transverse perineal muscles play a role in ejaculation. Here we have a picture of the pelvic floor musculature from up above at a bird's eye view. I don't know if you can see my cursor, but we have some structures that we are very familiar with, starting with the pubic symphysis, which is in the anterior portion, coming back to the coccyx and the sacrum back here. And these muscles, one of the things that my physical therapist that I worked with would use to speak about these muscles is that they act as almost a little basket there. And it's muscles we don't really think a whole lot about, but it acts as that basket that holds up our internal organs and all of that. So it's pretty important stuff. So a reason for referral for pelvic floor physical therapy would include, and may not be limited to, urinary incontinence, fecal incontinence, both of which are very common. I saw a lot of individuals in the clinic that I worked at, both male and female, for both of those issues. Pain with urination, difficulty emptying the bladder fully or even engaging in the start of urine flow, constipation or diarrhea, chronic pelvic pain, erectile dysfunction. Some of that can also be due to like operations in men when they have like the prostate removed and stuff like that, and where those nerves are not fully working. Physical therapy can also play a role in that. Painful intercourse, vaginismus, endometriosis. Endometriosis is a big one for me. Like I said, that's something I'm going to discuss. So that'll be a key thing that I want to touch on. Painful erection, painful ejaculation, premature ejaculation, and then pain in the back, hips, or sacroiliac joint. Another thing to keep in mind with those back, hip, or sacroiliac joint pain, you may come in contact with a patient who has pain in those areas, keeping in mind that that can actually stem from pelvic floor dysfunction of some sort. Just knowing that, because you could be working on those parts of the body and not really getting very far, and it could be related to a different source. So knowing that those are possible things is good. So some options for treatment when it comes to pelvic floor physical therapy could include education. A lot of individuals don't know a ton about our anatomy in the pelvic floor region, let alone how things work and what things are normal, what things are abnormal, what things can be helped and prevented. Another thing is pelvic floor exercises, which I'll touch more on. Biofeedback, which is going to give us a good indication on whether the musculature is contracting appropriately or relaxing appropriately, depending on what we're wanting the patient to do. Electrical stimulation and dry needling, both of which we did in conjunction at the clinic that I was at, which was very interesting. You get the needles and attach electrical stimulation to the needles. Then manual therapy, both options, internal or external, are there. Vaginal dilators, which can actually help to stretch the vagina if need be and malfunctions or tightening has happened over time. And then relaxation techniques. So pelvic floor exercises versus relaxation techniques is a big thing, because both things, weakness or overactivity of musculature, can sometimes have similar symptoms. So it's really important to assess which you're dealing with. And with pelvic floor exercises, it can be something, we'll go with a sit to stand as a basic exercise. You can start with something like a Kegel. A Kegel is just the tightening of the musculature and the vaginal opening, specifically in females, or the anal region for a male, and you'll just kind of tighten, and you can incorporate that with other exercises. So a sit to stand, and breathing is super important with this too. So for a sit to stand, if we are starting out seated, we want to do our Kegel during the difficult portion of an exercise, with a sit to stand being the standing portion. So we'll have our individual sit, take a deep inhale, which relaxes that musculature naturally. So take your deep inhale, and then as you stand, you're going to do your Kegel and then also an exhale. It's important that you do your Kegel with your exhale on these exercises, which there are many you can do, and just incorporate it like so. Also with relaxation techniques, a huge part of that is also breathing. We need the inhalation to really relax our musculature. There are certain positions that can be held that really help to relax that musculature, and with the incorporation of breathing. So now we're going to get into pelvic PT and endometriosis. For starters, what is endometriosis? Endometriosis is an often painful disorder in which tissue similar to the tissue that normally lines the inside of your uterus, the endometrium, grows outside of the uterus. And endometriosis most commonly involves the ovaries, fallopian tubes, and the tissue lining your pelvis. Rarely endometriosis or its tissues, the endometrial tissue, may spread beyond the pelvis into other organs. So signs and symptoms of that could include, not limited to, painful periods, pain with intercourse, pain with bowel movements or urination, excessive bleeding, infertility, and other things that could encompass a lot of issues include fatigue, bloating, nausea, diarrhea, and constipation. One of the symptoms of infertility is one that is particularly interesting to me, because I do have a friend who struggles with infertility. Come to find out recently, she was diagnosed with endometriosis. So that's kind of one of the reasons it really inspired me to do this talk. Some of the benefits of pelvic floor PT in conjunction with someone who has endometriosis is treating the trigger points in the muscles of the pelvic floor. The muscles of our pelvic floor hold tension just the same as our other muscles. For instance, our upper traps, notoriously tight. And that's exactly how the musculature of our pelvic floor works as well. And obviously things are more difficult to get to, but you treat them the same. We do myofascial release, we do stretching, we do strengthening with the pelvic floor muscles, as well as something more common to us like our upper traps. It also similarly decreases tension in the muscles of the pelvic floor. Like other muscles in our body, these muscles shorten when they are tight, and we're able to do some internal or external stretching to help lengthen those. So this musculature, it's common for us to think that if they're tight, they're strong, but often they are weak. So we need to do that lengthening and stretching before we get moving into the strengthening of those. And another point is decreasing endobelly, which is a way of saying bloating that's caused by endometriosis. And the bloating is just a protective response caused by lesions or tightness of muscles. And PTs can help to relax that protective response. Management of scar tissue. That is a huge one with endometriosis. As I mentioned, the tissues of the endometrium grow outside, causing scarring and adhesions, and that scar tissue can cause a lack of movement in the area, which can cause pain. And a pelvic PT can help release those tissues by doing massage and visceral mobilizations. Infertility, huge thing caused by endometriosis. It's a major thing is that scarring and adhesions that I mentioned, which causes that infertility because things are not moving the way they should, and it just causes havoc in the area. And about 40% of cases of female infertility, when we're talking specifically about biomechanical reasoning, is attributed by scarring and or pelvic adhesions. There's a lot of things that can cause those adhesions and scarring, but one of those top things is endometriosis. So it's a really big percentage of things that cause that infertility in women. And studies have shown that manual pelvic PT techniques can help increase chances of pregnancy in women with endometriosis, which is pretty phenomenal. One of the things I looked into was a study that showed that there was a group of women. It was a smaller case study with 14 individuals, but they found these women with endometriosis, but they also had additional health issues, hormone problems, pelvic inflammation disease, abdominal or pelvic surgeries, etc. And in that, with the use of the manual PT techniques, the conception rate was increased to 71.4% of those women ending with a pregnancy. And that was being compared to a different study, which I can't even say the name. It was in the Czech Republic, but that's a really good percentage. And it can also help to increase IVF pregnancy rates. So in summary and in my conclusion, one thing I do want to say before I move on to that is how sensitive that discussion of infertility can be for a patient, and really encouraging individuals. It's something really good to know, but really be aware of how sensitive that is if you do approach that subject with a patient. I would just really cautiously approach any of those topics. Now, summary or conclusion. Pelvic floor physical therapy can be life-changing for so many people. It is often an area that people shy away from due to embarrassment or a belief that their experience cannot be changed. It is important that as providers we can educate patients and are aware of their needs that might be outside of our own specialty. The symptoms that pelvic floor patients experience are very common, but they do not have to be accepted as normal. As PTAs, we can help provide the treatment they need or point them to recommended options. And here are my references. Thanks, everybody.